And from Delta, we come to Lagos. While Nigerians prepared for Christmas and New Year holidays at the beginning of December 2021, after crossing over 1,000 daily infections, the Lagos State government confirmed the beginning of the fourth wave of the pandemic. But over the weekend, the Lagos State Commissioner for Health announced the consistent decrease in COVID-19 case positivity, indicating an end of the fourth wave in the state. Well, joining us to talk more about this, Dr. Alera Roberts, a public health physician, joins us now. Thank you for joining us. We understand that you are on your way somewhere, but then thanks once again. Let me get straight to the point. Is Lagos out of the woods, and what can you point to as a reason why cases are now declining?
No, Lagos is not yet out of the woods, but we are clearly getting over the fourth wave. The reason why cases are declining, I think people are being more careful about social distancing, wearing masks, and clearly we're not getting as many symptomatic cases as we were getting before. So we are on the way out of the fourth wave, but we should not let down our guard.
Someone said that perhaps at some point the Omicron is now endemic, such that the population probably has developed antibodies. And this is also, if we put on the other hand, that perhaps not much testing is actually ongoing.
That is true, but we cannot say that people have developed antibodies unless we can test for the antibodies in their blood. And like you said, not much testing is going on. But then people are clearly not having the symptomatic version of COVID. And, people are being more careful about wearing their masks and making sure they don't go into crowded indoor spaces and being more careful about transmission of the disease. There are so many people who opt not to go into any of these events. But that, so people are on their guard. Of course, it does help that our vaccination levels are a lot higher than they are in the rest of the country, and people are getting vaccinated.
To you, what's your take on perhaps testing? What would you be more comfortable with in terms of what states should be churning out in terms of testing on a daily basis? And perhaps what test positivity rates would you be more comfortable with?
I'm not too sure that, you see, the issue of testing for me and for a lot of us is a bit of a controversial issue in the sense that I keep saying that if you don't have symptoms and you have a lot of stuff to get through during the day, why would you go for a test? And if the results are not going to be available immediately for clinical diagnosis or for use, then what's the point? So unless we can get a lot more of the lateral flow tests, which are like 15, 20 minutes and you have a result, the PCR testing, if you're not symptomatic, I don't see why we should force people to go and do it. What is more valuable is if resources can be deployed into making sure more and more people get vaccinated, because then we know that we're protecting them against severe disease, hospitalization, and death.
And of course, part of the mass vaccination drive is the approval for community pharmacists, laboratories accredited to also administer vaccines. And we understand this is happening in Lagos. But tell us, WHO says that the world's poorest continent should not only broaden vaccinations, but also gain increased and equitable access to some of the critical therapeutics to save lives and effectively combat the pandemic. Looking at Nigeria's case, do you think that we are looking at everything holistically and how to really ensure that, we can record 0 cases on a daily basis?
Looking at everything holistically is very good. Doing something about it would be even better. The one thing COVID has done for us in this country, it has exposed institutional weaknesses in the health system. The point is, what are we doing about it? That needs to be strengthened for everybody to get equitable access to effective health care. Just looking at it holistically and wringing our hands and, umming and awing doesn't solve our problem. We need to be able to strengthen our institutional healthcare delivery system to a point where every Nigerian is guaranteed access to equitable healthcare, equitable access to effective healthcare.
So essentially walking the talk. Thank you so much, Dr. Alera Roberts, public health physician, joining us from Lagos.
Thank you so much for having me.